Hello vetted family, it is Joel, and today we're going to go over how the calf works. In general, calves and forearms and hands and feet work in a similar way. When I dorsiflex my ankle, when I pull it back this way, I'm going to be activating tissues on the anterior of my calf. And we'll have a specific video to show you how to release the anterior of your calf. The posterior of my calf is going to push me down into plantar flexion. If I go to the lateral side of the posterior calf, these guys are working together to push my ankle into plantar flexion, which pushes the earth behind me when I'm walking or running. Then we go to the lateral side of the calf. And these muscles, they're called fibularis muscles or peroneous muscles. Two big ones run down the outside of the calf. The brevis inserts into the styloid process. And then the longus actually goes all the way around your ankle, and it has three pieces that insert into your first metatarsal. And then the last thing I want you to think about, my Achilles starts there. I want you to be able to get the Achilles in there. We also have a soleus that when your knee is bent, you can get into easier. It also helps push the earth away. We have videos for that too, and we're going to show you how to release all of them. This is going to be the peroneus release. Again, these muscles push the earth away from you, from the side of your calf. Think about the outside of my calf and the back of my calf push the earth behind me so I can go fast, so I can walk, so many different things. I prefer to use the Battle Star when doing these releases. You can use several other cylindrical objects. As long as they're dense, it should be fine. Just a heads up, there's a bone right here. It's the fibular notch. You basically want to go underneath it and behind it to get into the worst spots of the peroneus. This is going to require some core strength. It's going to require some shoulder girdle strength as well. You'll get your elbow underneath your shoulder. I don't want it out like here. This is going to stress my neck and my rotator cuff out. If I get it directly under my shoulder, I'm joint stacking, I'm stacking my bones, and they'll support me. I'm going to use this leg to push through the ground to raise my body up. This leg can step over or it can be behind. When you're up towards the top, you have way more tissue. The peroneus muscles are much bigger up here. As I go lower down my calf, the muscles get smaller. Whatever's the most sensitive is what I should focus on. If it's really tender, I can pause on it, and I can change the length of it by doing a pin and stretch technique. When I do dorsiflexion and plantar flexion, it changes the length of my peroneus. If your back strength or your core strength is a limiting factor, you can leave your hip on the ground and then put your other foot directly on top of the release tool. You can do the same pin and stretch technique. If you're really hardcore and you have the strength and the pain tolerance, you could do short strokes on it with your whole body off the ground. My foot's going to be passive so that I don't guard the tissue that I'm trying to release. But then I can also do pin and stretch.